How do you understand STI test results after exposure? When it comes to testing for sexually transmitted infections after potential exposure, understanding what your results mean is key to protecting your health. First, if your test comes back positive, it indicates that the laboratory found evidence of an infection. This could be in the form of antibodies, antigens, or the pathogen itself. A positive result means you have an active infection or have had one in the past, depending on the test. For example, a positive HIV test confirms the presence of the virus, and you should seek medical care to discuss treatment options. It's also important to inform your sexual partners so they can get tested and treated if necessary to prevent further spread. If your test results are negative, it means no evidence of infection was found at the time of testing. However, a negative result does not guarantee you are infection-free forever. This is because of the window period, the time after exposure when the infection might not be detectable yet. For some STIs, this window can be as short as a few days or as long as several weeks. Testing too soon after exposure might give a false negative result. That's why healthcare providers often recommend retesting after the window period to confirm your status. Sometimes, test results are inconclusive or unclear. This can happen if testing occurs very soon after exposure, before the infection has produced enough detectable markers, or due to lab errors. In these cases, your healthcare provider might suggest retesting after a certain period or using different testing methods to clarify the results. Timing is crucial because the accuracy of tests depends heavily on when you get tested. For example, Chlamydia and Gonorrhea can usually be reliably detected 7 to 10 days after exposure through urine or swab tests. HIV tests vary. RNA tests can detect the virus about 7 to 10 days after exposure, while antibody tests are more reliable after 3 to 4 weeks. Blood tests for syphilis become more accurate after 2 to 3 weeks. Herpes detection depends on whether sores are visible for swab tests or if blood tests for antibodies are used, which may take weeks to develop. Once you receive your results, the next steps depend on what they show. If your test is positive, seek medical care promptly for treatment and counseling. It's also important to notify recent sexual partners so they can get tested and treated if needed. If your results are negative but you tested early, follow your healthcare provider's advice on retesting after the window period. Continue practicing safer sex to reduce your risk of future infections. If your results are inconclusive, retesting as recommended is essential, and you should avoid sexual activity until your results are clear to prevent possible transmission. Regular testing is a vital part of maintaining your sexual health, especially if you are sexually active or at higher risk. Understanding your test results helps you make informed decisions and protect both yourself and your partners. Remember, individual experiences vary, and testing strategies should be tailored to your specific situation. Always consult healthcare professionals for personalized advice and follow their guidance on testing and treatment. In summary, interpreting STI test results involves understanding what positive, negative, and inconclusive results mean, recognizing the importance of timing related to window periods, and following up with your healthcare provider for confirmation or retesting. This approach supports effective management of your sexual health and helps prevent the spread of infections.